Mr. Speaker, as we discuss the issue of health care, one thing that's just brought up often is that why not let the government run health care after all? We already have it with Medicare, Medicaid, TRICARE, and the VA. Well, here's a true story. A gentleman in his 80s needs a motorized wheelchair, so he gets the medical exam. A few dozen pages of paperwork are filled out, and 3 or 4 months go by waiting for the wheelchair to arrive. Unfortunately, during that time, the medical exam expired after 60 days and has to be repeated. Again, more billing, a couple dozen pages of that, and he gets his $25,000 wheelchair. Unfortunately, by that time, he's in hospice care, can barely use it. And here's the other tragedy. It goes into storage, it can't be used, it cannot be returned, and it's a big waste of money in many ways. It's not atypical for issues with Medicare and Medicaid, quite frankly, will pay for this sort of expense, will not pay for the care it takes to prevent these sorts of problems. Before we take on more $1 billion worth of more spending, shouldn't we fix those things we're already responsible for? I think that would save a lot of money and, quite frankly, make a lot of sense and save a lot of lives. I yield back.